It's 6:47 inches the morning. Your alarm hasn't gone off yet, but something woke you up anyway. Not noise, not pain, not a bad dream, just your mouth. It feels like you swallowed a handful of chalk dust sometime around 3 a.m., and nobody told you. Your tongue is practically glued to the roof of your mouth. Your lips feel like they belong to someone who just crossed a desert, and you think, again. If that scene sounds familiar, I need you to stay with me for the next few minutes, because what most people assume is just an annoying aging thing is actually your body trying to hand you a very specific warning note, and most people never read it. Today, I'm going to read it with you, line by line. I'm DR.Camila, and if you're new here, this channel exists for one reason: to give adults over 60 the kind of clear, honest, research-backed health information that too often gets glossed over in a 7-minute doctor's appointment. We don't do fear here. We don't do clickbait. What we do is connect the dots. And today's exercise starts in your mouth, but it absolutely does not end there. Is greater than. Before we dive in, hit that subscribe button. Next week, I'm revealing a specific combination of 2 common supplements that might actually be robbing your body of a critical nutrient. You won't want to miss that. Why saliva is your secret armor. Most people think of saliva as just spit. In reality, your body produces between 1 and 1.5 liters of it every single day. It coats your teeth like armor. It neutralizes the acids that cause decay. It carries enzymes that begin digestion. It contains antibacterial compounds that fight infection. When that defense system goes offline overnight, it isn't trivial. A landmark study in Times Oral Diseases, Times, found that nearly half of adults over 65 deal with chronic morning dry mouth, xerostomia. But here's the kicker. In 80% of those cases, the dry mouth wasn't the problem, it was the signal. Think of it as a smoke detector. The detector isn't the emergency, it's the announcement of one. Let's figure out which fire your body might be pointing to. Cause has shown. The medication puzzle. The has-shown culprit isn't a disease. It's your medicine cabinet. Over 400 common medications, including blood pressure diuretics, antihistamines, antidepressants. Partner about your snoring. 3. Check blood sugar. Get an HbA1c test if you haven't had one in the last 12 months. 4. Scheduled hydration. 8 glasses a day, spread out by the clock. 5. Nighttime relief. Use oral rinses or gels containing xylitol, like biotin, before bed. Avoid alcohol-based mouthwashes. They make the problem worse. Is greater than. Urgent note. If dry mouth is accompanied by difficulty swallowing, white patches, or unexplained weight loss, see a doctor immediately. Closing. Morning dry mouth is common, but common is not the same as normal. You came here with a symptom. You're leaving with a map. I want to hear from you. Drop one word in the comments. Type sleep if you suspect you're breathing. Type meds if you're heading to the pharmacist. Type test if you're booking a blood sugar screen. I read every comment. Take good care of yourself this week. You've